Yeah. So when we talk about these long-term use of these medications or statins, many patients can show some concern about the long-term use of that. So how do you address concerns around safety and side effects in these lipid-lowering treatments?
Yeah, that's a great question because we come up with that all the time. We have people coming in and say, "I really don't want to take a statin. I want to do it with lifestyle." And I know that's a little frustrating for me at times when I have a very high risk patient. However, you kind of have to meet them where they are. You have to discuss what are your concerns, what is it you've read or heard on the internet. But what we know from hundreds of thousands of studies that statin therapy is extremely safe. Now, there are side effects, so we always have to be aware and discuss the side effects. The most common is muscle aches and pains, and that can be debilitating, and people will have to stop their medicines for it. So it's often if you try one, then you try another. We'll use a lot of vitamin D to prevent muscle pains, a lot of deficiency in vitamin D. That sometimes helps. Some people like to take CoQ10, and that sometimes helps for muscle aches and pains that come with it. But it occurs in somewhere between 5 and 20%, depending on how you define it. But there are studies showing that people that took a statin thought they were having myalgias, and they gave them what's called a nocebo, meaning they told them it was a statin, but it wasn't. They still had
Mhm.
muscle aches. So it's sometimes we we exercise hard and our muscles aches, and we want to blame it on the medicine, and it's not always the medicine, but it often can be. So we have to work with our patients. We have to discuss the risk benefits. We tell them about how we can reduce their heart disease risk by 30 or 40% from having a heart attack by being on a statin that does that. And it has so much, clear cut beneficial effects over hundreds of thousands of patients that we know the risk, we know the safety, which is very good. Just got to understand the side effects. And some people can't take them, and we use the alternative drugs. There's also bempedoic acid, which I think is available in India as well, which has a low risk of muscle pains as well, which is a pill. It also gives another, 20% reduction.
Yeah, yeah. Yeah, so anyone listening to the live chat here, if you have these questions or concerns, feel free to ask your doctor. They're here to walk you through things. And a lot of times we see just different things on the internet with, the rise of Instagram or TikTok. There's just a lot of information out there these days, but these doctors are here to help any questions or concerns that you guys do have.